When your family's in need of medical care, where should you turn? Come to Englewood Hospital, home of the most advanced technologies and medical equipment. Home to Magnet Award-winning nurses who deliver compassionate professional care. And home to more top-rated doctors than any other hospital in North Jersey. For your family's health, come to Englewood Hospital. We're closer than you think.
Hello, good evening. Welcome to Dr. Gore's show. Today, we have Dr. Jain with us to talk about link between oral health and general health. Welcome to Dr. Gore's show.
Hi, thank you, Dr. Gore.
So Dr. Jain did his training from NYU undergrad. Then he went on to do dentistry in New Jersey School of Dentistry. And then he did his fellowship at Sloan Kettering in Manhattan. He's been in practice, believe it or not, for more than 17 years in New Jersey, where he specializes in implants and oral health. So, you know, we all go to the dentist, and when we go, we're talking about cavities, we're talking about, whitening, we are talking about the appearance. But there's more to oral health than just the look of it. The way the gums look, the way the teeth look gives you like a detective job to tell about what's happening in our bodies,
Sure,
right?
sure.
So walk us through that. What does oral health give you idea about somebody's general health?
Okay. Oral health, believe it or not, is linked to a lot of different systemic conditions.
Okay.
It affects the whole body in multiple ways.
Right.
Now, focusing on the Indian population,
Sure.
Amongst Indians, we have a high risk of heart disease,
Correct.
high risk of diabetes.
Right.
Amongst Indians, oral cancer is the number one
Killer
type
disease.
of cancer.
Right.
Right? India has the highest rate of oral cancer compared to any other country.
Okay. And that's because of our tobacco chewing habits,
Correct.
pan.
We chew tobacco, pan, supari.
Right.
So all of these things do affect the rest of the body.
Correct.
Okay. So as far as gum disease go,
Right.
in India we call it pyorrhea.
Correct.
In the U.S. we call it periodontal disease.
Correct.
Some people call it gum disease. It's got a lot of different names to it.
Sure.
Amongst the Indian population, 90% of the Indian population in adults has gum disease
Okay.
of one type or another.
All right.
So it's a pretty substantial problem.
Correct. So sometimes like the gums look thicker, they look redder, they bleed while brushing.
Correct.
Are those like a signs of gum
These are the
disease?
signs and symptoms one looks for. In advanced stages, you'll see loosening of teeth.
Okay.
Okay, and eventually leads to tooth loss.
Correct.
Some people will just come and say, "Oh my God, my tooth just came out." That's the reason it just comes out.
Because it's not attached properly and the gum is infected between the tooth and the gum, and that pus or the infection can make the tooth loose.
Exactly.
All right.
So that's in later stages. But you
Okay.
know what? It's much better to catch a problem at an early stage
Right.
than at a later stage.
Sure.
So some of the signs and symptoms one looks for
Okay.
is bleeding of the gums when you're brushing.
Okay.
Healthy gums should never bleed.
Okay.
So many times I have patients coming into the office and they say, "Oh, my gums just bleed a little bit." They think it's normal. It's
Right.
not.
Sometimes I also used to think that if you brush harder, you can make them bleed.
That's correct. And that's not the case.
Right.
Brushing hard does not cause bleeding of the gums in a healthy mouth.
All right.
In somebody who's got gum problems, gingivitis or periodontal disease, you will see bleeding of the gums.
Correct.
Okay.
And I think we learned in our medical school and during OBGYN that if your gums bleed during pregnancy, that's a warning that they should see a dentist if they have not seen.
Exactly.
Because there's a link between oral health and
Correct.
preterm infections and preterm delivery.
Exactly.
Because it's a sign that there can be a systemic infection.
Right. So you'll see women having babies born earlier, prematurely.
Correct.
They'll be born with lower birth weights.
Right.
So
Some
these-
growth restriction.
Growth restriction. So, and believe it or not, this is all related. One of the factors
Right.
is the gum health.
Correct.
And people would not link that together, but it's
Right,
definitely a link.
right. And so a lot of times in my first visit during pregnancy, first visits, we say at least once see your dentist during
Correct.
your pregnancy, and they look at us like, why?
Right.
And then I explain to them, and they are so surprised to
Right.
hear that.
Typically for pregnant patients, we like to get them in every 3 months.
Right.
We find that, we're able to stay on top of their health better, and it's healthier for the patient.
Correct.
So it's definitely good for them.
So once you've seen this redness and bleeding, you've figured out there's some, is there anything you look for systematically or you advise them about their health, and how do you treat it then?
Okay. So, like I said earlier, you have the redness and the puffiness of the
Right,
gums,
right.
bleeding of the gums.
Right.
Another symptom that people don't,
Pay attention.
pay attention to is the breath. Sometimes you'll get bad breath, and it's coming because of the
Your
bacterial
gum.
infection of the gum.
So it's not just what food you've eaten or, right. So sometimes it's a sign your oral hygiene might be a
Correct.
problem.
Correct. Now, something good amongst our Indian population that we do is brushing our tongue.
Correct.
That really helps with keeping a nice fresh breath.
Right.
And that's something we teach our patients.
Right. And they're always surprised.
They're very surprised by it. Like, what do you mean brush the tongue?
Right.
Correct. So the other things we're looking for are some staining of the teeth.
Okay.
Okay. Now, supari, people who eat supari, they tend to have chipped teeth, broken teeth, and you'll see staining of the teeth.
Correct.
So these are the things that we look for in supari chewers.
Correct.
People with tobacco, they
Right.
tend to have a lot of staining of the teeth.
Okay.
Okay. So in gum disease, you'll also see sometimes recession of the gums. The
Okay.
gum, instead of being at this height, now
They're
comes
receding
down.
down.
Correct.
Right. So as we have seen in the picture that this is the first of the gum disease, right? How the
Right.
gum looks.
Correct.
And how when there's infection, as we can see here,
Right.
how does the gum look? That's because of the infection of the gums.
Exactly.
And then as the infection progresses, there are different kind of look to the teeth and the mouth that we can see on these
Exactly.
pictures. Okay.
So you'll see more loss of bone, you'll see loss of gum, and over time, as that keeps getting lost, you'll have loosening of the tooth.
Okay.
And unfortunately, then that leads to the loss of the teeth.
Correct. So even as adults, if you're losing teeth,
Right.
this might be related to your oral health.
Correct.
Okay.
Correct.
And then there are some pictures of the tobacco chewing and betel nut chewing
Yes.
that we can see how it's affecting the teeth and how it cracks because it's such a hard thing, right? When
Yes.
people are chewing it.
Yeah, like in this picture, you'll see the heavy staining and the chipped teeth.
Right.
This is all occurring just because of the
Eating those hard
sup-
suparis.
Exactly.
Because
Exactly.
not only it's bad for your health, but
Right.
the physical trauma of eating that hard stuff.
Correct.
eh,
It causes fractures in the teeth,
Correct.
and of course there's the risk of oral cancer as well.
correct. So, and the tobacco can also stain your teeth, correct?
Correct.
So your appearance also gets affected.
Yes.
So it's everything together.
Well, they say the smile is the gateway to a person.
Correct.
When you first meet somebody, what's the first thing you notice about them is their smile.
Right, right.
If somebody's smiling, that makes them more welcoming, warm.
Correct.
So
It says about the personality. And now
Exactly.
if you have the staining, I
Right.
think kind of it restricts you a little bit to be open about yourself.
yes.
So now we've diagnosed somebody with the gum disease.
Yes.
What's the next step? Do you do x-rays? How do you see how much is the damage?
Right. So there's several steps involved in doing
Okay.
a proper diagnosis for a patient.
Right.
One of the first things we do is what's called a periodontal charting.
Okay.
Okay? So if you look at my sleeve here, for example,
Right.
okay, there's a space between my sleeve and my arm.
Correct.
Okay? That is what's called a periodontal pocket.
Okay.
The space between the gum and the tooth is a
Right.
periodontal pocket.
Right.
If it's up to 3 millimeters, it's perfectly healthy.
Right.
Because studies have shown that if you brush a tooth, when you use a toothbrush,
Right.
it can go down 3 millimeters.
Okay.
Now, if you imagine somebody who's had gum disease,
Right.
that bacteria from that gum disease
Right.
destroys that attachment, attaching the gum to the tooth.
Right.
And so the pocket gets deeper and deeper.
Right.
Okay? So when it gets that deep, unfortunately, your brush is no longer doing a good job keeping
Correct.
it clean.
It can't go deep enough.
It goes exactly.
Okay.
So if you have bacteria all the way down here, and you have
You're just
brush
cleaning
only
it
going to the top,
superficially.
you're just cleaning at the top. So your brush and your flossing is not good enough.
Correct.
Okay. And then what ends up happening is that bacteria will keep persisting
Right.
unless you seek professional help.
So let me ask you, even though you might do, you're brushing, maybe flossing, which we Indians don't do as much.
That's correct.
And I know, Dr. Jen, you've told me so many times we have to do the flossing.
Right.
But what about, they talk about the mouthwash? Do you think, does it help a little bit to
It helps a
prevent
little
it?
bit. There's a few good products on the market,
Right.
that do a good job in
Right.
keeping the gums healthy.
Okay.
But again, it doesn't go down deep down the
enough.
pocket,
Okay.
right? So we were talking about diagnosing.
Mm-hmm.
So what we look for in the diagnosing is when you do the periodontal charting, you want less than 3 millimeters depth.
Okay.
Anything beyond that is considered periodontal disease.
Wow.
Okay. Bleeding on probing, meaning
Okay.
when you're doing the probing, if we see a little bit of bleeding coming,
Right.
that's a sign of inflammation.
Correct.
Okay. The other thing we're looking at is the x-rays.
Okay.
On the x-rays, we want to see good bone level all around the teeth.
Okay.
If there's loss of bone
Right.
around the tooth, that's again an indication of gum disease.
Okay.
Okay. So these are the indicators we're looking for.
Right.
So now, people get classified into different types of periodontal disease.
Right.
But bottom line is, they end up needing a deep cleaning for the most part.
Okay.
Okay.
So when they come for that 6 months cleaning, that's when you're looking for all this.
Correct.
And that's why the preventive visits are so important, because you can pick it up very early.
Exactly.
Okay.
So in our practice, we typically do the periodontal charting at least once a year for every patient.
Okay.
Okay. That's the recommendation from the American Academy of Periodontology.
Okay.
Okay. So once that periodontal charting is done, we have a good idea as to how they're doing.
Correct.
In addition to the X-rays.
Sure.
So if the X-rays and the periodontal charting is good, they get a regular cleaning.
Right.
Okay. If it's not good,
Right.
and we see a lot of tartar buildup, then we end up recommending a scaling and root planing, also known as a deep cleaning.
Correct.
Okay. That usually requires some level of anesthesia, so the patient's comfortable.
Mm-hmm.
We go in under the gum and get in really there and get that bacteria out.
Right.
The whole purpose of that deep cleaning is to make it easier for the patient to get under the gum and keep it clean themselves.
Okay.
Okay. And for periodontal patients, it's very, very important that they get their teeth cleaned every 3 months.
Okay.
Okay. It's not like a healthy patient where
Right.
every 6 months is okay.
It's good enough for that.
Correct. So the most important part, believe it or not, is not the initial deep cleaning. It's that
It's the maintenance.
It's the maintenance every 3 months.
So that the bacteria doesn't build up.
Correct.
So
Correct.
you're taking care of it every time.
Yes.
Okay.
Okay.
And do they need anything special, like at home, in that 3 month, in between those 3 months? Do they
Usually,
need?
just brushing and flossing is adequate.
Okay.
In some cases, we do recommend like a water pick, a water
Right.
irrigation,
Correct.
just to keep it clean.
Right. You advised me that, and
That's
we've
right.
been using that. Right.
And then also, again, I can't emphasize the importance enough of coming in every 3 months.
Correct.
That's critical.
Okay.
Okay.
All right.
When your family's in need of medical care, where should you turn? Come to Englewood Hospital, home of the most advanced technologies and medical equipment. Home to Magnet Award-winning nurses who deliver compassionate professional care. And home to more top-rated doctors than any other hospital in North Jersey. For your family's health, come to Englewood Hospital. We're closer than you think.
Now, once we've diagnosed somebody with gum disease, now, apart from the disease that we talked about, is there something like heart disease, as you mentioned? What are the signs of those? How do you figure out that there's some gum disease happening due to the heart disease?
Okay, so in the bacteria that's being in the gum disease, it creates inflammation.
Right.
Right? So that same inflammation goes through the body and causes other problems.
Right.
Those inflammatory products can
Right.
go into the heart vessels, like the
Sure.
coronary arteries,
Right.
and they create buildup of plaque
Correct.
inside the coronary arteries. Now, as you know, amongst Indians, we
Right.
have smaller coronaries than the other populations.
Correct.
Right?
And we are anyways more risk for coronary arteries because of the diet and the cholesterol issues.
The ghee.
Right.
I love my ghee. But
Right. So those are the risk factors we already have.
Correct.
On top of that, the oral health kind of plays in some role.
Exactly. So that bacteria, unfortunately, will cause a higher rate of buildup in the arteries, which leads to a higher risk of heart disease.
Okay. Now, is there a link between infective endocarditis and oral health, or is there a correlation?
Sure. People with poor oral health are much
Right.
more prone to infective or endocarditis.
Right.
Okay. So that's why it just is much nicer to keep a clean mouth.
Right.
It leads to a healthier body.
Correct. So it's not just for the smell of it, the look of it, the bleeding of it, but also the better your oral hygiene, the less chances of infection in your heart, during pregnancy, or an overall health.
Correct. Now, another disease that Indians have a lot of is diabetes.
Correct.
Correct?
Right.
So there's a substantial correlation affecting the diabetes from the
Right.
gum disease,
Right.
and vice versa, the diabetes affecting the gum disease.
Okay.
Okay? So a patient who has diabetes,
Right.
okay, they will have a very hard time keeping their gums healthy.
Sure.
Okay? Because that inflammation constantly keeps affecting the gums,
Right.
which in turn then the gum disease...
And also diabetes makes you prone for infection.
That's correct.
So that's how it's going.
Correct. And vice versa, if somebody has bad gum disease, they cannot get their sugar in check easily.
Right.
So there was a patient we had when her teeth were so bad that her sugar was never under control.
Right.
As soon as we took her teeth out, her sugar control became much more manageable.
Right. Because as we all know, if there's some sort of infection in the body, it's harder to control the sugar levels.
Exactly.
So that sometimes is the cause for diabetic ketoacidosis, any infection.
Sure.
And because it releases the steroids in your body and stress reaction. So yes, the diabetes gets a little bit harder to control if you have infection. So, but that's a very nice point to know that if suppose the diabetes is not getting control, maybe look into your oral health as well.
Exactly.
We pay a lot of attention to people who have diabetes about their leg checkups, their kidney checkups, their heart checkups, but we never emphasize enough about their oral health.
Exactly.
And I think that's something you brought up, very important, that please, along with seeing your podiatrist, your kidney specialist, your diabetic specialist, see your dentist as well.
Right.
And that's a very important point.
Now, another good point that goes along in that same line of thought is if, from periodontal disease, one can lose teeth.
Correct.
Okay? Now, as we get older, the teeth become even more important.
Right.
Because now, when you're a diabetic, you need to eat non-carb type foods.
Correct.
Okay? Every food that is soft
Right.
is high in carb.
Correct.
So if you have less teeth, you're eating more high-carb diet.
Correct.
And unfortunately, that's when it becomes a bigger problem, because when you need to control your sugar even more, it's harder to do so with the lack of teeth.
And that you brought a very important point, that a lot of times when we talk about different kind of diets, we ask, or the patient asks, like, what I'm eating, how does that affect my oral health? So as you said, high carb food are very soft and they're easy to eat.
Correct.
But the healthy food sometimes can affect, like I love nuts. And then a lot of times they get stuck inside. So if I don't brush it immediately, I'm worried that there's some infection going to grow.
Correct.
So yes, nuts are healthy for your health, but sometimes not so healthy for your teeth. So is there any food which is really bad, like candies? We know it gets stuck in between your teeth and it's not good.
Believe it or not, from a dental disease, there's two primary diseases.
Okay.
You have dental caries, cavities,
Correct.
or you have gum disease.
Correct.
Okay. Now, with dental caries, the main things that we have to be careful of is carbs.
Correct.
Okay. Anything that's high in sugar is going to cause tooth decay.
Correct.
A cavity actually forms when your bacteria in your mouth, which everybody has, there's healthy bacteria.
Sure.
That bacteria is eating the same sugar and the carbs that you ate.
Right.
So if you don't brush your teeth at nighttime and that sugar stays all night long, the bacteria is having a big feast in your mouth.
Oh yeah, they're having a party time, right?
Party time, exactly. So that bacteria, unfortunately, the byproduct of that is lactic acid, which dissolves away the tooth structure.
Okay.
And that's how a cavity forms.
The enamel of the tooth.
Correct. Right. And that's how the cavity forms.
Right.
So good foods to eat to prevent tooth decay are cheeses.
Okay.
Okay. Cheese is actually very good, and it's supposed to be, cavity protective.
Because of the acid in it?
Correct. It's the acid. It's also got it neutralizes some of the other acids that are produced by the bacteria.
Okay.
The bacteria in the cheese neutralizes the bacteria that's causing the cavities.
That's very interesting to know. Right.
Fruits and vegetables are good as long as it's fibrous and you get it cleaned off the bat.
Right.
Okay. You don't want anything sitting there for a very long time.
Right.
Like bananas, believe it or not, cause a lot of cavities.
Wow, see?
Okay.
That's nice to know.
Another thing we see commonly amongst young kids is Gatorade.
Correct.
Like the athletes. They
Right.
drink a lot of Gatorade, it's nothing but sugar.
Right.
Okay? So if somebody's drinking Gatorade all day long, you'll see...
And they don't wash it down with water.
Correct.
Then it's going to sit on it.
The key is anything sugary or high in carb, wash it down and rinse your mouth out with water. And make sure you're brushing every night before you go to bed.
Take that thing.
Correct.
Okay. Also, like as you mentioned, like a lot of times you're eating salads and those salad leaves do get, stuck in the thing. So I think it's very important to carry a brush with you or at least a floss that you can floss it out after dinner.
Exactly.
So those are the healthy food, but unfortunately, if you have to still keep an eye on your oral cavity to make sure they are taken off. So we've spoken about, the diabetes, the blood pressure, the gum disease, vice versa effects, and, moving on to modern technology and advances in your field, especially you do so many implants.
Right.
Is there something which is happening new, apart from the implant that we've talked about in our last show about the bridge and different kinds of implants?
Right.
Is there anything new?
There's actually some pretty amazing technology that's coming about.
Right.
We're now able to give somebody teeth within 1 day.
Right.
So somebody who's had gum disease, let's say,
Okay.
and their teeth are loose,
Right.
they're having a hard time eating,
Right.
their quality of life is poor, they don't like the way the teeth look. In a matter of a day, they can come in, have their teeth removed. We usually do this under sedation, the patient's comfortable.
Sure.
Get the teeth out,
Right.
put implants in the same day,
Okay.
and have fixed teeth connected all in the same day.
Wow.
So in a matter of a few hours, patient goes home with a beautiful smile,
Right.
looking good, feeling good, and being able to eat reasonably
and
well.
healthier mouth now.
And a healthier mouth, because now you've gotten rid of all the infected teeth.
So it's like a one-day transformation.
Yes, exactly.
It's a makeover,
It's
right?
it's an instant makeover.
Wow, so that's amazing. So you take out the old teeth because there is an infection, you clean
Correct.
the gums, and then you put few implants
Correct.
to
It's
hold those
typically
artificial.
anywhere from 4 to 8 implants.
Okay.
On the average, it's about 6 implants.
Right, to hold those fixed tooth over it.
Exactly.
And that's one of the one-day makeover, which is amazing.
It's fantastic.
Because I remember when I got implant from you, it was like a few-day process.
Correct.
And now
Correct.
things have changed.
Correct.
Wow, so it's
This is
amazing.
only good. This works really well when it's multiple teeth.
Right.
Right. You can't do this. For a single tooth, it's harder to do.
Right. This is like all in one shot. It's easy
Exactly.
to take care of it. And they come out with a beautiful smile.
And they look great and they feel great.
Right. Is this kind of implant good or not good for somebody who has, because of bisphosphonates they've taken?
Yes.
Does that work for them as well? Because it's kind of like a bone disease, not as much as gum disease for them, correct? So
Correct.
are they candidate for those implants?
So somebody who's had bisphosphonates, now you have bisphosphonates for osteoporosis,
Right.
and you also use bisphosphonates for treating people with malignancies, right?
Right.
So the ones that are administered by IV, generally we don't treat those patients with implants.
Okay.
Because it's too risky to treat that patient with an implant.
Correct.
However, the ones taking something like a Fosamax,
Right.
okay, with oral bisphosphonates,
Correct.
the jury's still out on it,
Right.
but we've been treating patients with it without having any problems.
Right.
So it's been relatively safe.
Right.
Can
And-
I say it's 100% safe? I can't.
Of course.
But it's relatively safe.
Right, because usually, my patients, when they are taking all this, I always emphasize to make sure the dentists are happy with that, because
Yes.
sometimes we have issue.
Correct.
It's their oral health versus their bone health.
Right.
And but it's nice to know that if they are ready to follow up with their dentist very, thoroughly, and there is a possibility they could still get the implant.
Correct. Now, I have to tell you, the best thing is prevention.
Correct.
Prevention is the best cure. Regular cleanings.
Right.
This way you can avoid all of these expensive and invasive procedures.
Right.
Best thing is just get the teeth cleaned regularly.
Right.
Stay on top of it. Amongst our Indian population, that's something we worry about because they don't like to go to the dentist.
Correct.
It's not in our culture.
Guilty.
Yes, exactly.
Right.
So-
So I know it's hard, and especially if something is not broken, like you say, like, why would I go?
Yeah,
like,
it's not bothering
I'm good.
me.
Right, I'm good.
Right. Another misconception is people think by getting their teeth cleaned, they're damaging their tooth.
Right.
And that's a big misconception because they think that they're taking away the outer layers of the tooth structure, which is not the case.
Right. Unless until there's a very harsh cleaning, like especially like it's not done by a professional.
Correct.
Then there is, I remember like in old times, people used to have, I think, some kind of a tree root they used to clean their
Yes.
teeth with, and then they would take it with salt and be very abrasive.
Right.
I think those are different things than
Yeah,
the
like
cleaning
the
that we do with
powders.
the, right,
Yeah.
the professional cleaning that you do. So
Yes.
I think we've covered a lot today. We have spoken about correlationship between your gum disease and your general health, and why it is important when your teeth don't look right. If there's a discoloration, your gums are bleeding, as Dr. Jen mentioned, that's never a good sign. If they are swollen, if there's you brush your teeth, you haven't eaten, say, garlic or onions, and your mouth is still not smelling good, I think it's time to pay a visit if you have not done to your dentist. Also, there are new advances, as we spoke about different kind of one-day implants, and there's always a solution to a problem, but let's tackle the problem when it's just starting, and prevention takes us a long way than treating it when it's beyond our initial stage. So I think regular checkup with the dentist is great, and if you would like to see Dr. Jain, his practice is in New Jersey. He has a beautiful brand new office. You can do a video visit to the facility on the website. It's amazing.
Right. We have a video tour.
And it's very amazing, and they have up-to-date all the technology there. So it's great. Thank you for coming on Dr. Gore Show.
Thank you, Dr. Kaur.
All right.
Okay.
Have a good night.
Good night.
Till next time, stay healthy. Good night.
When your family's in need of medical care, where should you turn? Come to Englewood Hospital, home of the most advanced technologies and medical equipment. Home to Magnet Award-winning nurses who deliver compassionate professional care. And home to more top-rated doctors than any other hospital in North Jersey. For your family's health, come to Englewood Hospital. We're closer than you think.